All right, welcome everybody to this webinar today. My name is Dr. Erick Bingham. I'm with Utah Valley Pain Relief, and today I'm excited to talk to you about a condition called RSD and CRPS. This condition is a condition that I've treated successfully in my office and treated the pain associated with this condition. So today I'm going to talk about what this condition is, some of the causes of it, and how you can do to treat it. So what is RSD? What's CRPS? So they stand for reflex sympathetic dystrophy, or complex regional pain syndrome. It's actually a rare condition that involves the nervous system, the sympathetic nervous system specifically, and it causes extreme pain in the patient, and unfortunately there's not a lot known about this condition and why people get it, but there is some things that if we can find out more information about it and help people understand what it is, they're going to be able to help their doctors maybe look in that direction and then give some possible treatments to be able to help people feel better. So with not knowing a lot about it, it can be very difficult to diagnose and therefore difficult to treat. Patients can go for months or even years before finding out really what their condition is. And the important part is, if you can find out if you have RSD or CRPS early on, then you're going to be able to treat it and have a better chance of getting rid of it. So this is why I'm doing the webinar today, is to help people understand a little bit more about it. Maybe they have a family member or you have it yourself, and sometimes learning as much about the condition as you can, be able to help treat it to make you feel better. So what RSD is, or CRPS, it's a pain condition. Pain will often start in an extremity like an arm or a leg, and it's usually from trauma. So it doesn't have to be a major trauma. I've had a patient who just stepped in a hole when he was out on the farm, and he started developing the symptoms of RSD. I've had patients who had surgery done, and after coming out of the surgery, they had chronic neuropathic pain, or this chronic pain syndrome. It can be from trauma to a nerve, so it can happen to anybody really, but it's not common, but it can happen. So it's usually the extremities, usually one side more than the other, and it's usually, some of the symptoms are is a burning, chronic burning, severe type of pain. There is skin temperature changes. You may be able to feel on the arm or the leg where on one side it would be cool and on the other side it would be hot. There may be even sweating on that one side. There will be edema or swelling around the area of pain. You'll have color changes. I've had people come in and one leg is totally different color, maybe like a purple or blotchy or red, maybe even like a shiny, thin kind of texture to it. If it's on the hand or foot, even the nails will look different. The hair growth on the legs are different. It's very sensitive to touch. It's called allodynia, where skin is so sensitive that a breeze or the skin having any kind of temperature change will trigger the pain. Just a light touch on it will cause the pain. You'll have muscle spasms or cramps in the legs. It's just a severe condition. It's very, very, very painful. So some of the complications associated with it is when you don't use that part of your body, you can develop muscle atrophy, where the muscle will start to deteriorate and get smaller, or it can go into spasm and cause muscle tightening in that area. Some of the other complications is, when you're in so much pain, you develop depression. You're not be able to go to work. You're not be able to go out and hang out with friends, and it can be very depressing type of condition. I have people that just lay in bed and stay at home because they don't want to go out and be with people because they're in so much pain. So I'm going to talk a little bit about how it's diagnosed and some of the tests that you can do for that. Like I said before, it is difficult to diagnose because most medical doctors are not looking for this type of condition because it is rare. So unfortunately, it goes either misdiagnosed or undiagnosed, and so learning about it as much as you can, maybe be able to help somebody that that is suffering with it. So what will happen is you'll go in, and a medical doctor should do a full history, a medical history, a physical exam. They'll do some bone tests to rule out any underlying conditions or problems. They'll do x-rays, possible MRIs to rule out any nerve compression, nerve damage. They'll do nerve conduction tests where they test the nerves to see if they're functioning on each side. And they'll do some sympathetic nervous system tests. And your doctor will know what those are. They'll go through those tests. Common treatments for these conditions consist mostly of pain medications. With RSD, it is a condition that's very hard to fix, and so it's mostly treating the symptoms. So common ones would be narcotic or opiate type of medications, or anti-seizure medications such as Lyrica, gabapentin, and those affect the nerves. They may try physical therapy, nerve blocks, spinal cord stimulators. So there's a lot of things that they will try, but unfortunately, those have really limited effect on neuropathic pain or RSD. They don't really work that well. So these patients will suffer a great deal of pain with no great solution. So I've had patients come in with so much pain that they were willing to amputate their arm or leg because it was so severe. These people are very depressed, and which I can understand with not being able to get rid of the pain. So this is what we treat. One of the things we treat in our office, and we treat it with a new kind of therapy. It's an FDA cleared device that treats chronic neuropathic pain, and we're having some fantastic results with it. And it's really the only thing I've seen to really make a great deal of change in patients' pain, because of the medications and other things out there are not very effective. I just had a patient come and see me. She had RSD. She had it for over 9 years. Had unbearable type of pain. In fact, she wore a glove on her hand because any breeze or any kind of light touch or anything like that would just send it into a flare and increase pain. And her level of pain was an 8 or 9 when she came in, where 10 is the worst pain you've ever felt. So she was in a lot of pain when she came, suffering for many years. She had tried nerve blocks, surgeries, medications, acupuncture, you name it. She tried everything she could think of with no relief. She heard about the Calmare therapy and decided to give it a try, and within 10 visits she was completely out of pain when she left my office. So typically it takes 10 to 12 treatments for the average pain condition that we see. Some people take longer, some people less, but that's the average, and we're having some fantastic results with it. So it looks like I have a few questions that people are asking here. One, let's see, can RSD or CRPS spread from its original location? It's a good question. Yes, it can. RSD is not just a specific place on your body. It's actually a sympathetic nervous system problem, so it can affect any part of your body. I've had a patient who had it in their hand and went and got a surgery on their jaw, and it spread to their jaw. Another patient got surgery on their knee, and it spread to their knee. So it's anywhere there's trauma that's induced to the body, and so it can it can spread from its original location. It can get larger, so making sure you treat it properly. Another question is do you use ice as a treatment for RSD or CRPS? It's recommended not to use ice or heat or contrast heat with RSD. That can actually make it spread. So only in severe cases where maybe the swelling is so bad that you need to get that down, where ice is recommended. But I would definitely not recommend ice for an RSD patient. Question is, how many Calmare pain clinics are there? There's in Utah, I know of 3 places that have the Calmare machine. We're centrally located in the middle of Utah, south of Salt Lake, but there's several back east. But I think there's maybe 25-30 clinics in the United States that have this type of therapy. It's a relatively new therapy. It was from Europe. I was in Europe for the last 12 years, and the last 2 or 3 years is when it was brought here to the United States. Other than RSD, CRPS, what are some of the other conditions we treat? We treat with the Calmare therapy neuropathic pain. So that can be post-shingles pain, or what's called post-herpetic neuralgia. We treat sciatica. We treat neuropathy in the feet, peripheral neuropathy, diabetic neuropathy. The type of sensations we're looking for is pain, severe pain, chronic pain, pain that's there 24/7. Those are the type of conditions and that we do treat. Will Calmare hurt me if I'm overly sensitive to pain? So there's really no major side effects with Calmare. That's what's nice about this type of therapy. We're very careful where we place the therapy so that it doesn't increase your pain, and if it does, we turn it off immediately. But it's a very safe therapy, and it's worth trying. It shouldn't increase the pain. So, the last question here: what is the best way to contact if you have questions? Well, we are located in Utah, Pleasant Grove, and our information is on the slide. You can also look us up on UtahValleyPainRelief.com. But give us a call. The best thing we can do is talk to you on the phone and see if you're a candidate. We offer a free first treatment. You can come in and try it out and ask the questions, and we can usually tell from the first treatment if it's something that we think we can help and help you get better. So that's our main goal. So I'll wait for just another couple of minutes, see if there's any other questions. I appreciate you coming on and listening to the webinar, and hopefully we'll see you soon if you need our help.